Students who are going to attend for hospital administration management, your exam entity dates are from 10th August to 21st August. Okay, and the finalized date will be mentioned, informed to you by July end. Okay, or you can contact me on my personal number. I guess all the HA students have my personal number. Just contact me on my personal number. Be in touch with me during the July last week and August first week. You will be updated with all the important aspects of the exam. Okay, so we'll start with the important topics of HAM. Legal aspects of hospital administration. The entire chapter is important. Planning, all topics. It's a very small chapter. Okay, wherever I have mentioned all topics are important, all subtopics and bigger topics are important, means these are the small chapter. You can't miss any points in these chapters. Decision making, page number 78 to 81. Focus on these areas only. Job designing, it's just a 2-page chapter. Everything is important. Especially difference between job enrichment and job enlargement. Okay, question will come on that. Directing, all topics. Motivating, all topics. Leadership also, all topics. Different types of leader, different types different leadership styles, very important. Okay, focus on that. Hospital planning, these are the page numbers. Take a screenshot or just contact me. I'll forward you the content. Then we have outpatient department, all topics. It's a very small chapter. Okay, all topics are important. Specifically the administrative zone, clinical zone, service area, etc. What all area, what all sub units or what all user departments come under these areas. Be thorough in that. Emergency services, all topics. Inpatient department, these are the page numbers of inpatient department. Just focus on this. Operation theater, all topics. ICU, again all topics, different types of ICU. Okay, equipments used in ICU, diagnostic, therapeutic, monitoring equipment. What are the examples of these different types of equipments? It's the last part of the ICU chapter. If you know the textbook, last part of the ICU chapter, very important. Laboratory, these are the page numbers. Focus more on the quality aspect of laboratory services. Okay, the quality indicators of laboratory, please focus on that. Radiology, different types of radiology services. Square meter flooring size for different equipments. It's mentioned in the textbook. Read that. Transfusion services, again, just leave the national blood policy because a lot of amendment has taken place which is not there in the textbook. So just quit that zone, national blood policies and the legal aspects of transfusion, because the recent amendments have not been mentioned in the textbook. So there is no need of learning that. Then MRD, all topics. CSSD, page number 318 to 324. Housekeeping, all topics. Transportation services, all topics. Waste management, all topics. Occupational safety, again, topics, different types of occupational hazards in the hospital. Clearly they have mentioned. Okay, read that. Quality in healthcare, only focus on these page numbers. Media relations, just focus on these page numbers, 475 to 477. Telemedicine, only few page numbers you have to focus on. Medical tourism. Then section 9, which are the MTP Act, PNDT Act, and the Human TOA Act, transplantation of human organs and tissues. Okay, TOA Act and all, you don't have to read from the textbook. I have taken a separate presentation on this based on the recent amendments, but again the same applies here. These sections are the old laws and regulations which are not applicable in these days. So no need to worry about the section 9, that is the appendix A, appendix 5 and appendix 6. All the exam briefing which I'm taking right now will be uploaded to the YouTube channel. So please contact me to get the YouTube channel link. So you will get the recording of all the sessions. Okay. So there is no requirement from my side to repeat the slides. You can get access the recordings on the YouTube channel. So sample questions from hospital administration management will somewhat be like this. Okay, like biomedical waste should not be stored beyond how much hours? Okay, 48 hours, not more than 48 hours within the hospital. Recommended numbers of ambulances under Rao committee for a 150 bedded hospitals. Okay, it's three ambulances. Usually go by, like, if it is a 50 bedded hospital, one. Just add one ambulance to every 50 extra bed. Okay, that's what Rao committee has followed. You can keep that in mind to memorize the number of ambulances. If you have any question regarding the important topics, contact me on the personal personal WhatsApp. Glossary, acronyms, and tools for all the subjects, ICM, QCM, SSGB, as well as for hospital administration management. Just go through it. Don't expect much questions from this area, but just for your information, be thorough in this. Now coming to the exam briefing. This is same for all.